back to the Dr. Greg Jones Optimization Academy. I am pleased and honored to bring back Dr. William Seeds for part 2 of our talk on peptides and cellular medicine. For those who missed part 1, we're going to do a quick recap of that. But first, let me reintroduce Dr. Seeds for those that don't know. Dr. Seeds is a board-certified surgeon. He's been practicing medicine for over 25 years. He is the founder of the International Peptide Society. He's also the founder of the Seeds Scientific Research and Performance Institute, and one of the top minds, top researchers in peptide therapy here in the United States and across the world. So he is one of the guys, the head honchos on peptides. I'm very excited to have him back on the show. Dr. Seeds has been honored at the NFL Hall of Fame. He's treated professional athletes across all professional sports, from hockey to baseball to the NBA, and also has treated people, the dancers on NBC's Dance with the Stars. So when it comes down to it, we are honored to have Dr. Seeds back on the show, and we're excited for part 2. So welcome back, Dr. Seeds.
Thanks for having me, Greg.
Thank you. Thank you. So for those that missed part 1, it is available on YouTube and Spotify and iTunes and all your favorite podcast channels. But what we talked about was what cellular medicine is, how that's important for anyone that's trying to optimize their health and trying to increase their longevity, anti-aging, performance, all that good stuff is all tied into the ability to understand the cellular environment, how to improve the cellular environment, and how to improve the cellular environment. So that being said, one of the things we talked about in relation to getting better, oh gosh, man, glad I have an editor for this. One of the things we talked about when it comes down to improving cellular health and cellular medicine was peptide therapy. And that's what we're going to spend part 2 on. So for those out there who don't know, who have somehow not listened to any of my podcasts, any of Dr. Seeds' podcasts, we'll start with this. Dr. Seeds, what is a peptide?
Well, a peptide is basically we can look at it as a chain of amino acids, anywhere from 2 to, you could go as high as, you could get into polypeptides as high as 100 or more. But basically they're typically between 2 to usually around 60. Most of the ones that we look at, and most of the ones we use are less than probably 30 or 40 amino acids. And they're bonded by peptide bonds. They're amino acids that can be bonded by these peptide bonds that are either in a straight chain, or they're helical, or they're cyclical, and that just determines their it's a conformational change that can occur at the receptor when it's utilized. It makes it either more stable or more active, and basically their peptides are, we'll look at it in the realm of their signaling agents that are sending messages between cells or between organelles in cells, like from the mitochondria to the nucleus, so the nucleus to the peroxisome, or the peroxisome to the mitochondria, or from muscle to the brain, or the gut to the brain, or I mean, they go everywhere in the body, and they're sending messages the body's familiar with, and then acting accordingly with other, with what the specific messaging is.
And so for me, one of the ways I like to explain to my patients what peptides are, I use a city environment. And I'll say, just imagine that your body is a city. I'm in Phoenix, I believe you're in Cleveland. Our body is the city, and our cells are going to be, it's called the buildings in the city. And think of those peptides as, you can call it a messenger, you can call it a text message, you can call it a courier. They're going to take that, that signal and go from potentially one part of that city, one part of the building, another part of the city to another, and it's going to say, I need you to do something here. So I need to make this happen. So that communication between those cells is how I start the discussion on peptides here. So, and what's cool about it, and it's like, well, if we already have it, why do you want to give it to me, right? Because clearly we can make peptides, correct? And so that's going to be the question. I'm going to toss it over to you. When someone asks that question, like, okay, if we already make these peptides, Dr. Seeds, why do you want to give them to me?
Sure. Well, unfortunately, it has to do, fortunately, it has to do with this interesting thing called aging, and how, as we are all genetically programmed to end our to die at some point in our lives, there are these genetic mechanisms that we can't change. We can influence, but we can't change, that have everything to do with how slowly aspects of our immune system change, how our hormones change, how everything kind of potentially dampens down and dampens in response to signaling to just kind of slow down the process of how the body activates cells efficiently and so forth. And how the and what understanding that gives us the ability to say, well, wait, if the body's capable of doing these things and it's just about signaling, could we offset some of these aspects of, let's say, aging that affect about everything? Affect how a cell works efficiently, affects how a cell utilizes energy, affects how the immune system works. Can we influence that to work better for ourselves as we age? And the answer is absolutely. And we know that based on exercise and nutrition, because exercise and nutrition influence peptide signaling. And so if exercise and nutrition can do that, because that, we can make the case of just showing how we age in the people who do exercise and eat and follow a proper nutrition, they do much better combating disease and aging, and age, if you want to say it, age gracefully, and really do have those golden years in their lives and really do make the most out of their life. I'm not talking about making people 140 or 150 years of age. I'm just saying, hey, how would you like to live every day of your life the best you can? And because I don't plan on retiring, I don't plan on, I want to live every day and do my best every day. And I want to be able to, I want to be as active as I was when I was 20 as I am now at 60. And I'm doing that. Than I was at 30. And I can back it up. So it's kind of cool when you can look at life like that and say, well, okay, there are things you can do to improve life. And that has to do with other things too, with wound healing, or, how can I improve healing? Can I improve the immune system when things are maybe okay, or can I just make it modulate better? The answer is yes, yes, yes. So I hope that answers the question.
No, absolutely, it does. Absolutely. So it's just, we're designed to age, and this is why we do hormone replacement and optimization. And the older we get, the less of these things we have. And so if there's a way we can optimize that, bring them back to the levels where, in the case of hormones, when we were younger, in the case of peptides, more efficient communication, then why wouldn't we? We have the ability to do that in a safe way. Then why would we not do that? It's like, I just don't ask the question, why, that feels like, why should I be on peptides? I'm like, why are you not on them already? If you're a candidate for it, so it's just a matter of the desire to want to optimize their health and understanding how to do that.
And it's also about cellular protection. It's protecting the cell from the environment. We in our lives now, in the world we live in, it's all about these environmental influences, as you and I refer to them as epigenetic influences. And I am a firm believer in what I teach and preach about signaling agents that absolutely can change and protect the cell from these factors, because it's really environmental changes that lead to a lot of problems in life. So if we have the ability to protect the cell and let the cell make its decisions, like we talked about in our first podcast together, I mean, that's a pretty powerful formula if we're talking about cytoprotection.
Indeed. So that being said, this is the part, the drum roll, the part I've been excited about, and I'm sure many of my listeners are too. Dr. C's, we've been talking about peptides, we've been talking about cellular medicine, but let's get into a little bit more detail here. Let's talk about, I told you 5, we'll start with 3, we may get even further. Tell me about your top 3 peptides.
Wow, I mean, that's, for me, I'm going to say that's an easy question, then it's a complicated question.
It's like I'm trying to ask you, who are your top 3 cousins?
Yeah,
So,
because depending on what I'm trying to do and who I'm working with, it could be something different. But I'm going to start off and say there is really there is a foundation that I think everybody needs to appreciate and understand, and that's the foundation of the GHRHs and the GHRPs, and that's the GHRH is the growth hormone releasing hormone, and the growth hormone releasing peptide, that being like CJC and ipamorelin, the GHRHs and the GHRPs, because those truly are the foundation of establishing this, what I just said, this story of cytoprotection. Because they're so powerful in what they do in regulating the release of natural endogenous growth hormone. And that is a master hormone that everybody has the right to utilize and to improve, because it makes such a difference in so many places. And that's because every cell has a growth hormone receptor. And on top of it, you have growth hormone releasing hormone receptors and growth hormone releasing peptide receptors. And that makes it even more interesting, because then these peptides have not just one purpose, but they have pleiotropic effects, meaning they have many effects. And that's where it gets really exciting, because if I take that and I say, well, gosh, how do I look at this? And I look at it and saying that if I can influence, again, we're not using synthetic growth hormone, we're using a peptide that signals your release of your endogenous growth hormone. That growth hormone has so many downstream effects. It has an effect on body partitioning in lean muscle mass and fat oxidation. It has a role in improving in producing IGF-1, which is a very significant and another hormone that's very important and kind of coexist growth hormone. And we won't get into, I won't get into all the complicated pathways of the cellular mechanisms, but that being said, it's so involved in cell metabolism with all the good things. And then it also has these other aspects of turning on and reviving the immune system, which is so important. And so you've got just two peptides, GHRHs and GHRPs, that have a profound influence in so many areas of not just aging, but in immune function, in obesity, in diabetes. And I mean, we could go on and on and on of how many areas that it touches, and what a significance it can make in improving all the things we work on as people get older, in improving the microbiome and gut dysbiosis and problems in the bowel, improving exercise performance or utilization of energy in exercise performance, and making the most out of your exercise. Because it's truly not, when you look at these things like GHRHs and GHRPs, are they making you an athlete better? What they're doing is they're making the area of where this athlete performs in training better, so that athlete can then train to become better. And that's where everybody misses the boat, because it works on recovery. It improves recovery. It gives the athlete a different way of approaching, or just a weekend warrior, or just like you and I. It gives us the ability to train, but train at a different level, because we understand that recovery is now a different story for us. And that enhances performance, because we're taking advantage of recovery. And that's a missed message, because everybody thinks, oh, this thing's going to enhance and make me better. Well, no, it makes you better at what you do at your training. And so your training then becomes even more effective for you. And then, the things like neurocognition in the brain. I mean, these aspects of what these GHRHs and GHRPs can do are just profound, and in improving brain-derived neurotrophic factor, which is so important as we age, and actually has everything with stopping neurodegenerative diseases. So I could make the statement, I could truly make the statement that younger people, everybody's looking for well, how do I stop this prevalence of what I see now happening in the world of neurodegenerative problems like Alzheimer's and Parkinson's and all these things that are happening, more so Alzheimer's and neurocognitive loss, are the things I can do now to prevent that. And we know absolutely exercise and nutrition, right? But some of these peptides, like these GHRHs and GHRPs, starting, as we start to decline, like right after our 30s, when things just start to change, we could really take advantage of understanding how the body changes and make the most out of preserving and protecting our neurofunction, our kidney function, our liver function. I mean, it really is amazing if you think about it, that I could make that statement and say, look, I can protect you from this problem. And I feel very confident in that because we can go through all the mechanisms of how that works. And that's just 2 peptides, right? That's 2 peptides, but they set such a foundation for moving forward. And preventing, what's the biggest thing with aging as you age? It's stopping and slowing down senescence, cellular senescence. So if I have something that works as to modulate the degree of senescence, that's amazing right there. So you've got these incredible players, and they're just 2 peptides. And and that's why, that's actually, that's how this all started. It's when you asked me in our first podcast, you said, Dr. Seeds, how did you get cellular medicine started? How did that start? Well, I started with those 2 peptides because they carried such a profound message of cell signaling. And they had so many influences in every part of the body that I could talk about the kidney. I could talk about glomerular filtration, and I could talk about the liver. I could talk about, NASH and all the things, all the bad things that happen in the liver and the good things. I could talk about the pancreas. I could talk about the islet cells. I could talk about the heart. They have an influence everywhere in protecting the cell and making things better. I've spent days just talking about each one of them. So in a short answer, those 2 are my first 2 that I would say. The GHRHs and the GHRPs are, I think, make just such a profound statement in where you can start with anybody and give them, understanding their, that about their history and so forth, and what other problems they may have in their life. If they're the right candidate for something like that, I think it's something to seriously think about. And I can tell you, I've been one of those people who for over 15 years has been doing that. So, and it's absolutely made a difference in my life. And that has something to be, I think that says something right there,
Oh, it's amazing. And they're foundational peptides for me. Like, there aren't many peptide protocols or longevity protocols or performance enhancing protocols I put together that don't include those 2 peptides. They just do so much, and I think you kind of covered all the things they do. Now, a question I do get, and I think this may be for someone who's not familiar with peptides. The first question, I don't know when you started, if you still get it, you may say, Dr. C's, if growth hormone is so essential and it's so important and it protects us against so many things, why are you giving me a peptide? Why don't you just give me growth hormone? Because is that not the end game? How do you respond to that question?
And that is a really good question, Greg. And it's a great question for everybody, physicians and everybody out there, because the answer is, it's complex, but we can make everybody understand it if we understand a principle. A principle is that the brain releases growth hormone in pulses, and it does it maybe anywhere from 3 to 6, some say up to 9 pulses in a day, but typically it's anywhere from 3 to 6, maybe 7, but they're always split up by about 3 hours, okay? Most of the time. And so that means there's a reason for that. There's a reason because growth hormone then will stimulate signaling pathways throughout the body and mechanisms and reactions need to occur. And if just imagine, and then systems have to reset. They have to reset. Imagine if you give somebody a synthetic growth hormone, that means that's in the body and it's turned on. There's nothing pulsing out of the brain. It's going all the time. It doesn't matter if it's low dose or high dose, it's going all the time. So it's constantly hitting receptors that aren't ready to be hit 24/7 while that drug is in your body, because its half-life continues. You know, it doesn't, when you take synthetic growth hormone, it's there and it doesn't diminish. You just get a constant bleed. So that bleed of growth hormone causes problems. And it actually, we know on the cell level, if we want to get down to the cell level, it causes premature cellular senescence. So it leads to problems. And in the beginning, you may think, oh boy, this is amazing, I'm getting all of these benefits, but you're also burning out the cells. You're actually burning yourself up. It's like a fire that you don't even see coming. And that's, you know, a lot of great work was done early on with growth hormone, and it's fantastic, and we've been able to learn a lot from it. But here's something else that's real important. That synthetic growth hormone is just one type of growth hormone. Okay, it's one isoform. Your brain makes hundreds of isoforms of growth hormone depending on what the demand from the body is, because different growth hormone molecules will go to different areas of the body because they've been summoned, they've been asked. We don't even understand that stuff yet. But we know there are over hundreds of isoforms of growth hormone. That's incredible, right?
It's amazing. Yeah. And just think 1 versus 100, you know, and I try to have that conversation with my patients too. Like, hey, you know what, if we want a more broad spectrum, the right growth hormone for the right job, and you're not going to get that from the recombinant version. So, and that's what that comes down to.
And it's all about a little bit is just enough, right? We're the tortoise in this race. We don't want to be the rabbit. We want life working our way for us.
Exactly. So those are 2 very powerful peptides right there. So that's our number 1. We call it 1A, 1B. And so what would be the next peptide that you would consider one of your favorites?
I'm going to have to say BPC 157. It's just so utilitarian in what I would call its repair mechanisms. It's just an incredible peptide. It's another natural peptide that I feel has, and in my experience, has just been another wonderful, simple peptide with no secondary problems at all in working with and really getting real results, as I am with these others, right? That are measurable and quantitative, and it's just incredible to see all the different benefits that I see with the peptide that has so many crossovers. And I think the best way to look at it is it's really a utilitarian repair peptide. And that meaning, you know, ligamentous or collagen or cell breakdown in the gut, or it's got so many places that it repairs. It repairs in the brain, it repairs in the gut, it repairs in muscle or ligamentous injury. So it can be, you know, you can think of it as a super anti-inflammatory because it does have pain. It does reduce pain in different types of pain scenarios. It's just, it's incredible how many. So, and actually I'll bring this up. It's got so many places that it's valued in, and I think in treatment plans, and it's why I include it. It's another base peptide I include in that platform where I say it's got so many uses. Why shouldn't we be using it? And it's funny that some of the original, the Croatian team that really brought all of the research to light and did all the wonderful base work on this peptide. I had a really good discussion with one of the original researchers, and I used to talk, we'd have these discussions about different peptides, and they would just say, they'd say, Dr. Steves, why are you bringing these other peptides up when all you need is BPC 157? Why are you bringing any of these up? Because all you need is BPC 157. And in some respects, they're correct. It is an incredible peptide. And like I said, I've from the performance side to the gut dysbiosis to inflammatory autoimmune issues to neurodegenerative problems. It just has so many crossovers to enhance, what you're doing. And in fact, BPC has a unique ability to increase growth hormone receptors on cells. So what it's doing is enhancing the utilization of your other two peptides. So that's why I like using them together, because BPC can improve and enhance growth hormone receptors and make the most out of what you're doing with your GHRHs and GHRPs. So those three are really the are again where I started with, just explaining, giving people some early on peptides that I think could make a difference in their practice, and were those peptides that would bring people, there's a lot of medications and things that we use that sometimes people don't even realize they're working. And you've got to explain to them, look, there's things happening behind the scenes, and we'll see this 3 months, 4 months, 6 months down the road. But these are a couple of peptides that sometimes, and most of the time, people really start noticing early on. And then they're captured, and they're like motivated because they see something happening, they feel something happening, and then you've got their attention. They're like, well, what else can I do? If this is working like this, how do I make this better? And that's, where your nutrition and exercise become even more powerful, because you've got their attention, and you can bring a lot of these things together.
I would put BPC in my top 3 as well, my top 2. And I like the fact that it's that utilitarian point of it can be used for so many things. I mean, you can take BPC as a capsule for gut health and for liver health. And I've treated patients with reflux with BPC 157. I'm sorry, I've treated reflux with oral BPC 157. So many different things. And then you can do it as an injection, as you mentioned, some of the tendon and ligament injuries and reducing pain. I've used BPC as a nasal spray. We used it as eye drops, as toothpaste. There's so many different things you can do with this peptide that can, because it's a healing peptide all over the body. So I can't see many healing protocols not having BPC 157 in there, to be honest with you. So that's just one of the great ones. Hall of Fame peptide right there. So we like
that. I like that Hall of Fame peptide.
It will be there. It will have its number retired. So we got those two, and we got a little bit more time here. If you had to bring another peptide on this bus with you, we're on a boat, you only bring one more peptide with you for this trip. Which one would you bring?
Wow, for me, I think that's an easy one, and it would be, it's between thymosin alpha-1 and thymosin beta-4. And it's going to be thymosin alpha-1, because TA1 is just, it's the beginning of, it's really the most incredible immune modulator that we've ever worked with. I feel like it's made a difference in what we do in our practices to really work with difficult patients and bringing back immune modulation. And in fact, sometimes before you get to the use of CJC and ipamorelin and the GHRHs and GHRPs, you got to hit the immune system first and get things modulating correctly, because sometimes they'll be way too sensitive to the GHRHs and GHRPs. So that, and just the fact that the immune system is so integrated in tissue repair, and also in the how it's so closely affected and modulated with the gut and the microbiome, and so influenced by the microbiome and gut dysbiosis, and how we lose the thymus as we age, and how the immune system absolutely is downregulated because of the loss of the thymus, and And the loss of, thymosin alpha 1 is something you're making most up until your 30s. And as you start getting into your 40s and 50s, you start losing, you lose your thymus. You're not making that TA1 like you did when you were younger. So to me, it's something that is so crucial to that maintenance part I was talking about as we age, and is a critical one for me too, is in my older patients, and in maintaining immune modulation. I always, you'll see these things out there, and I don't mean to correct people, but I hate when I see upregulate the immune system, because you don't upregulate, you give the immune system the ability to modulate, because it's always changing. And that's the importance of the immune system, to modulate, not to upregulate. It's to upregulate and downregulate, because that's what it's doing all the time, if we go into the detail of it. And this is a peptide that allows, it works on both sides of the TH1 and TH2. It works on both sides of the innate and the adaptive immune system. And as we're finding out, and as I've been discussing since, back when I started this with peptides, I really started bringing in the systems and explaining to people, hey, the immune system is everything. It is everything we are discussing today. It has everything to do with aging. It has everything to do with disease. It has everything to do with trauma. It has everything to do with everything. And we're just starting to appreciate it. And so in long story short, TA1 is just this incredible peptide, and it's the only natural senolytic peptide we have in our body. That's a true senolytic, that recognizes, that can help the immune system recognize senescent cells and remove them. And that's important to understand. So thymosin alpha 1 is a huge player for me in the peptide world.
I am really glad you brought up that point about the upregulation of the immune system, because that's another one that kind of drives me a little crazy too, because I'm like, well, I don't really think you want to overly upregulate the immune system, because there's another word for that. It's called autoimmune, but that's okay, or they may call it, there's also that term cytokine storm. That's an over upregulation. I don't want that. My patients don't want that. I want immune system balancing. I want modulation. That's what I want. I don't want an upregulation, because, and I don't know if it was it may have been at the last conference where it may have been you, it may have been another speaker, said, the immune system is amazing because it's the one system that can heal you and hurt you. And you want to make sure you're on the healing side of it. So knowing how that works is super important across the board. Indeed. So I think I've taken up your time. I think that's it, man. I think my dime is up, as we used to say back in the day here. So I appreciate the time here, Dr. Seeds. I'm hoping to have you back as a guest in the future, because I feel like we just scratched the tip of the iceberg on peptides here. We just talked about 3, basically.
Yeah.
And there's so many more amazing ones out there that can be talked about.
Yeah, it'll be my pleasure, Greg, to come back and talk about anything anytime you want. I just have to say, it was really a pleasure for me to see you at the PWC, at the Peptide World Congress, because I'm looking at you and I go, I know that guy. I know this guy. And I got to tell this story so everybody can hear this, because I think you deserve this. I happenstantially ran into you. You came up in my Instagram feed, and I'm like, who is this guy? And I just started listening. To you, and you're talking to your patients about something you were doing. And I was like, I really like this guy. He's such a good communicator. What he's communicating is absolutely on target. And I was like, wow, this is a gifted individual. I really like this. And so I would occasionally you would come up and I'd listen to you, and I'd like go back, I don't go in Instagram a lot, but I go in and I'd look for you and I'd look for what you're doing. And then I'm standing in my conference and I see this guy and I go, God, he looks familiar. And then you come up and you give me your name and I'm like, I know you, and I said, and you're like, you know me? And I go, yeah, I know you. And I just want to tell you, you're doing a great job for your people out there. And it's a pleasure for me to help you in any way. So I love what you're doing. And it humbles me that you even come to our conferences and that you're part of our team. I
appreciate that. And I remember that moment, because I think you walked away and I Karen was like there. I was like, he's bullshitting, right? And she's like, no, he really knows you. I was like, oh, okay, that's cool. And I appreciate that. I did appreciate that. So it's an honor as well. So I'm going to handle this one for you this time. So for those out there that want to learn more about Dr. C's and SSRP and more about peptides, a few ways to do that. You go to ssrpinstitute.org. You can follow Dr. C's on Instagram at Dr. William A. C's, MD. You can, do you have a separate podcast of your own, or is it through the website?
It's through our Instagram, which
Okay.
I'm not sure what that, it's SSRP Instagram or me or William Seeds MD. I'm not sure.
You go to the William A. Seeds MD, you'll find all the SSRP stuff. So you guys can
Yeah.
follow there. I'll have links and all that below in the notes for the Instagram. So sorry, in the notes for the YouTube and the podcast. So no excuse for not finding out more information on Dr. C's and what's going on in the world of SSRP. That being said, we want to thank you again for being a guest here. It was a pleasure and an honor, and we will talk to you soon, Dr. C's, and goodbye to everyone out there.
Thank you, Greg. Appreciate being here.